Okay, we're going to look at sprains and strains. Just so we know the difference between a sprain and a strain, you sprain your ankle, which is tendons and ligaments that are affected, so that would be your wrists and your ankles. Generally, they're the most common sprains that people get. Strains are muscular, so you strain your calf or you strain your bicep, and that's muscle tears and stuff like that. That's where, or you tear a bit of the muscle. Treatment is exactly the same for both. The risk is sometimes where people think they've sprained their wrist, they've actually broken it. There's obvious things, you're going to see some slides or some pictures within your presentation that will demonstrate the difference between a broken wrist and a sprained wrist. Okay, with both conditions you'll get swelling. A couple of little things I always do. So if Cara says to me, I think I've sprained my wrist, what I would do is I'd say, right, Cara, just show me both your wrists, lift your sleeves up. Okay, show me both wrists. Now, which is the injured wrist? This one, okay. So what could I do to make myself be able to see that more clearly? Take off the jewellery, because again, if you're going to get, he couldn't help himself there. If you're going to get swelling, you need to remove jewellery, really important. The same when we treat burns, you get swelling, remove anything that could be constrictive. So could you just take your watch off for me, please? Fantastic. Right, so now show me both wrists. So what I'm actually doing here is I'm making a visual comparison between the two limbs. So if they've got one injured limb, compare the limbs so you can actually see any differences. So turn them over. Okay, that's good. Now what I'm going to do now is you compare any, again this is to eliminate the fact that that might be broken rather than just a sprain. So what I want you to do is I'm just going to put some gloves on, just for the purpose. Actually I don't need to do that, I'll just wash my hands afterwards. Right, take hold of my hands, my fingers, right, and squeeze both fingers. So what I'm checking for there is the amount of strength in the injured hand, okay? Because if it's significantly less, that's erring towards a possible fracture. Okay, let go. And then the other thing I could do is when I make an examination, soft tissue, tell me when you feel any pain, soft tissue. So as soon as I touch bone, if she starts, oh, that's the only way to confirm a fracture is to go and get an x-ray, and that would be, you need to go to hospital and get an x-ray done, okay? Lots of what people have initially diagnosed as a sprained wrist have turned out to be a broken wrist, okay? So if you're not sure, take them to hospital, they'll do some tests, they'll do tests like that, and then they'll get an x-ray done, and that's the only way to confirm it. It could be a basic fracture, or it could be a proper break. If it's a significant break, you'll see significant deformity, okay? Now with a basic sprain, best way to treat that, whether it be an ankle or a wrist, is with ice. Now before you put an ice pack, this is a chemical ice pack, you just pop it. You normally got these in first aid kits, okay? Pop that on, but it's normally good practice, put a tea towel or a bit of cloth around it first when you put it on. Get them to hold it on, because they're controlling the pain, they're controlling the pressure. Just pop that on your wrist. Just hold that on there, fantastic. Now the other thing you can do is to get them to elevate it as well, lift it up. Again, that just takes a bit of the blood build up and it reduces the risk of swelling. Ice is very good for reducing swelling, okay? And it's a natural defense mechanism of the body to swell, to immobilize it. Now, generally, same with fractures or with sprains and strains, immobilizing it is really important. So if somebody's injured something, sprained their ankle or sprained their wrist, whatever activity they were doing, stop it. Don't keep doing it, rest it. Now we use the mnemonic RICE, which is rest, ice, compress, and that could be a tubey bandage or a strap, bit of strapping, and then elevate. So rest it, ice it, compress it or support it. Now support could be as simple as what you were doing there, just hold your arm, just support your arm like that, so support. So compress and support, and then elevate, and that's built in, elevate, okay? And that applies pretty much with sprains, strains, and with fractures. Now, if somebody's got a significant lower leg fracture, my priority is not to move them. The only occasion I'd move somebody with significant fractures is if they're in imminent danger, i.e. we're in the middle of a house that's on fire. The priority is getting them out of that house, and that means there's going to be pain. That's where I'd be asking for somebody to give me a hand to move them to reduce the risk of increasing any likely injuries, okay? If it's an arm injury, if it's an obvious fracture, then they can support that. Just get them to move about with their arm in that. Now, at what point do you decide whether this is an ambulance? If they're in immense pain and they're not doing what they're told, or they're really struggling, or it's a significant, I know, maybe an open fracture. Again, I'll refer to the pictures you're going to see, the different types of fractures, because there's 4 main types of fractures. There's a closed fracture, which is a broken bone inside the body, an open fracture where bone is sticking out of the body, and don't do what they do in the movies where they try and push it back in. You don't do that, leave it. You have a complicated fracture, which is near a blood vessel or near a joint. And then the last one is a green stick fracture. And the green stick fractures are normally prevalent in children. Their bones are very pliable, so they don't properly crack. It's a bit like, it's called a green stick fracture. If you pull a live branch off a tree, and I'm not suggesting you do that, it's not environmentally friendly, but if you then try and snap it, it doesn't snap. It fractures, okay? And that gives you a green stick fracture, and that's what happens with young children. With an older person, you bend their bones and they snap, properly snap, okay? As we get older, our bones become less pliable. Occasionally you might have heard those, I think it was an Italian gymnast a couple of years ago at the last Olympics, did a vault, landed, and you could hear the snap of his tib and fib snapping throughout the whole auditorium. And then you obviously saw the significant deformity as his lower leg was flopping about. So it's something to be aware of, okay? So look at the method of injury and what's actually happened. How high have they fallen from, those sort of things. Okay, so that's sprains and strains, okay? So RICE is a mnemonic, rest it, ice it, compress it, elevate it. Fantastic, thank you.